Welcome to this video entitled, Pharmacotherapy of Diabetes Mellitus. Ellen is a 44-year-old woman who works full-time as an art teacher in a local high school. She also teaches art courses on the weekends at the local seniors center. She visited her healthcare provider last week for her annual physical exam and to update her tuberculosis screening, abbreviated as PPD skin test, for the coming school year. The office called her this morning with her laboratory reports and requested that she make an appointment to discuss the results tomorrow. Her serum glucose level is elevated at 14 millimoles per liter and she will need further testing to rule out type 2 diabetes mellitus. Ellen has follow-up testing, with the results of a fasting serum glucose level returning at 8 millimoles per liter and a 2-hour 75-gram oral glucose test returning at 13 millimoles per liter. A diagnosis of new-onset type 2 diabetes mellitus is confirmed. Ellen expresses disbelief and tells you, "The nurse, I can't believe it. I watch what I eat. I don't eat a lot of sugar, cookies, or candy. I drink only diet soda. I don't have any of the symptoms you hear about. And no one in my family has ever had diabetes." A health history and the results of Ellen's recent physical examination confirm overall good health. Her height is 167.6 centimeters, that is 66 inches, and her weight is 79.5 kilograms, that is 175 pounds, with a body mass index, abbreviated as BMI, of 28.2 kilograms per meter squared, placing her in the overweight category. Vital signs, physical exam, and all other laboratory workup are within acceptable limits. Ellen admits that she has been thirstier lately, but it's summertime and I always drink more when it's hot. She has also been urinating more frequently, but attributes that to her increased fluid intake. Ellen's healthcare provider will start her on glyburide, marketed as diabeta, and metformin, marketed as glucophage, and will recheck her serum glucose in 1 month. In the meantime, she is to begin capillary blood glucose testing before meals and at bedtime and to bring her blood glucose log to the next visit. She is given dietary instructions, and you will be providing instruction on her medications. Question 1 reads, why are 2 oral anti-diabetic drugs prescribed for Ellen? Oral anti-diabetic drugs are often used in combination to better treat type 2 diabetes mellitus. Glyburide, marketed as diabeta, stimulates the release of insulin and increases the sensitivity to insulin in peripheral tissues. Metformin, marketed as glucophage, reduces blood glucose by reducing glycogenolysis and decreasing the intestinal reabsorption of glucose. Together they work by different mechanisms to lower blood glucose levels. Question 2 reads, what essential teaching does Ellen need about her glyburide, marketed as diabeta, and metformin, marketed as glucophage? Ellen should take the drugs before her morning meal. If the metformin prescription is not an extended-release formulation, additional doses throughout the day, around mealtimes, may be required. Hypoglycemia is a possible adverse effect, particularly from the glyburide, and Ellen should be taught how to monitor her fingerstick blood glucose levels. Appropriate care when ill or if Ellen changes her exercise routine should also be discussed. Question 3 reads, Ellen asks why she is not being started on insulin. Why is insulin not being used at this time? Clients with type 2 diabetes mellitus produce their own insulin, but it is either insufficient to meet their body's needs or their body has developed a resistance to it. Providing oral drug therapy that assists Ellen's own insulin to work more efficiently is a goal of therapy for type 2 diabetes mellitus. While insulin may not be needed at this time, it may be needed in the future, particularly if illness or stress cause blood glucose levels to increase. Note that you could always start with insulin in a type 2 diabetic. However, oral therapy is always preferred to start with at the beginning. Question 4 reads, Ellen tells you that she occasionally enjoys a glass of wine with her dinner and wants to know if this is allowed. How will you answer? Occasional small amounts of alcohol may be allowed, but Ellen should discuss this with her healthcare provider. Alcohol consumption increases the risk for hyperglycemia and hypoglycemia, and it is known to produce disulfiram, that is antabuse, type reactions in clients who are taking glyburide. If the provider allows Ellen to drink an occasional glass of wine, she should be taught to consume the wine along with meals so that the food balances the alcohol consumption. She should also be taught the symptoms of a disulfiram type reaction and to notify the provider if they occur. Question 1 reads, a client with type 1 diabetes mellitus will use a combination insulin that includes neutral protamine hagedorn and regular insulins. The nurse explains the importance of knowing the peak times for both insulins. Why is this important information for the client to know? Is it A. The client will be able to estimate the time for the next injection of insulin based on these peaks? Or B. The risk of a hypoglycemic reaction is greatest around the peak of insulin activity? Or C. It is best to plan activities or exercise around peak insulin times for the best use of glucose? Or is it D. Additional insulin may be required at the peak periods to prevent hyperglycemia? The correct answer is B, and the rationale is: insulin peaks are the times of maximum insulin use with the greatest risk for hypoglycemia. Options A, C, and D are incorrect. Because the risk for hypoglycemia is highest at peak serum insulin levels, exercise or additional insulin may increase the risk further. Insulin schedules for the client are developed by the provider, and the client should not self-select a schedule for insulin use. Question 2 reads, before administering a morning Lispro insulin, marketed as Humalog, injection, which activity should the nurse perform? Select all that apply. Is it A. Obtain a morning urine sample for glucose and ketones? Or B. Check the client's finger stick glucose level? Or C. Ensure that breakfast trays are present on the unit and the client may eat? Or D. Obtain the client's pulse and blood pressure? Or is it E. Assess for symptoms of hypoglycemia? The correct answers are B, C, and E. Rationale. The blood glucose level should be checked prior to administering most types of insulin. Because Lispro, marketed as Humalog, is a rapid-acting insulin, the nurse should ensure that a meal is available and that the client will be able to eat shortly after receiving a dose. If signs of hypoglycemia are present, the insulin dose should be held and the client treated for hypoglycemia. The provider should be notified. Options A and D are incorrect. Urine testing for glucose and ketones does not give exact information, and clients vary on the degree to which glucose and ketones will spill into the urine. While a check of the pulse or blood pressure may be included in routine vital signs or to further assess symptoms of hypoglycemia, they do not provide information directly pertinent to the administration of insulin. Question 3 reads, the nurse would consider which of the following assessment findings adverse effects to metformin therapy? Is it A. Hypoglycemia? Or B. gastrointestinal distress? Or C. Lactic acidosis? Or is it D. weight loss? The correct answer is C, and the rationale is a serious adverse effect of metformin, marketed as glucophage, is the risk for developing lactic acidosis. Renal insufficiency and failure, excess alcohol use, and IV contrast agents increase the risk for lactic acidosis and are contraindications to the use of metformin. Options A, B, and D are incorrect. Hypoglycemia, gastrointestinal distress, and weight loss are common adverse effects to most oral anti-diabetic drugs and are not specific to metformin. Question 4 reads, a client was started on rosiglitazone, marketed as Avandia, for type 2 diabetes mellitus. He tells the nurse that he has been taking it for 5 days, but his glucose levels are unchanged. What would the nurse's best response be? Is it A. You should double the dose. That should help. Or B. You need to give the drug more time. It can take several weeks before it becomes fully effective. Or C. You will need to add a second drug since this one has not been effective. Or is it D. You most likely require insulin now? The correct answer is B, and the rationale is it can take several weeks for rosiglitazone, marketed as Avandia, to provide full therapeutic effects, so the appropriate response would be to give it more time to reach effectiveness. Options A, C, and D are incorrect. It is not within a nurse's scope of practice to prescribe additional drugs or change the dosage. The healthcare provider should be consulted about any change to the client's drug regimen. Question 5 reads, a young woman calls the clinic and reports that her mother had an insulin overdose and was found unconscious. The young woman gave her a glucagon injection 20 minutes ago, and her mother woke up but is still groggy and does not make sense. What should the nurse tell the daughter? Is it A. Let her wake up on her own, then give her something to eat? Or B. Place some hard candies in her mouth? Or C. Just let her sleep? People are sleepy after hypoglycemic episodes. Or is it D. Give her another injection and call the paramedics? The correct answer is D, and the rationale is glucagon injections can be repeated if one dose is not effective. Hypoglycemia is a medical emergency, and because this woman has not fully recovered, medical attention is needed. Options A, B, and C are incorrect. The client is still experiencing symptoms of hypoglycemia, and continued treatment is indicated. Because she is still groggy and disoriented, it would not be safe to give this client anything by mouth. Thank you.